In this segment, we're going to talk about how to manage acute pain utilizing your TheraTouch EX or CX4 device and a symmetrical biphasic waveform. The treatment approach is using a sensory TENS application to create an analgesic effect for pain relief or pain modulation in some cases. The mechanism of action in this case is a gate control method of pain modulation via hyperstimulation of those A-beta sensory nerves to block pain at the dorsal horn of the spinal cord. The clinical example, as you can see with the patient with the electrodes on the shoulder, is an acute rotator cuff repair. The application of the electrodes, if you look closely, is one electrode, this in this case is a 2x2 inch square electrode, on the anterior shoulder and one on the posterior shoulder. Essentially, we're bracketing the area of pain or surrounding the area of pain, allowing the current to flow through the shoulder to get the best possible outcome. Now remember, dosing your intensity is part of the process and is a very important part of the process to driving good outcomes with this kind of mechanism, okay? We want to dose the intensity to create a physiological effect and not to just a set number on the device, meaning the milliamps of the output. In this case, we want to turn up the intensity to get a twitch level response to affect those motor nerves, and then just back off slightly so we're getting a maximum sensory stimulation, again, to create the best analgesic effect. For this treatment, this is how you set up the protocol. You're going to select electrotherapy, manual operation, biphasic, symmetrical biphasic waveform, the appropriate channel that you'll be using, and here we're going to adjust the frequency to 100 pulses per second. We're going to adjust the phase duration to 80 pulses per second. Now it's just a matter of increasing my intensity. I'm going to take this up to the motor level. So I'm going to visibly look for that twitch level on the patient's shoulder, which I see right now. I'm just going to back off a couple of notches. Now let the treatment run. Now, what's important to understand from a clinical perspective and patient outcome is try to create some functional exercise, some movement while you're doing the stimulation rather than doing stimulation first and then exercises next. Let's combine them to get the maximum benefit of your pain relief and obviously accelerating your outcomes as well. One simple technique can be, if the patient is standing, have them just bend over slightly, hang the shoulder, and then just slightly swing the shoulder in a pendulum position or a pendulum direction, if you will. Okay. Another exercise you can incorporate is just a simple passive range of motion with the patient. You can also consider as a progression from there is using active assist range of motion, maybe with the bar.